Chapter 15, Intervention Modalities, Part 1 of 2. This presentation will provide an overview of Chapter 15 from the O'Brien and Hussey textbook published in 2012. During this presentation, we will attempt to answer the following three questions. What are intervention modalities? What are the four categories of intervention modalities within OT practice? And what are some examples of intervention modalities? After viewing this presentation, parts 1 and 2, you should be able to do the following. So let's take a look at a couple of the questions that we posed at the beginning of the presentation. 1. What are intervention modalities? Your textbook defines intervention modalities as the principal tools of occupational therapy practice. What are the four categories of intervention modalities within OT practice? According to the Occupational Therapy Practice Framework, the four categories of intervention modalities include the following. 1. Therapeutic use of self. 2. Therapeutic use of occupations and activities. 3. Consultation process. And 4. The education process. Let's begin with therapeutic use of occupations and activities. A few definitions. These are a few definitions related to the therapeutic use of occupations and activities. The main point is that during intervention, the OT considers both medium and method, choosing the medium that will target the desired therapeutic response. Let's consider preparatory methods, which we've talked about on more than one occasion. Preparatory methods, hence the name preparatory, are used to prepare the client in preparation for engaging in a functional task. They are used in conjunction with or in order to prepare the client for purposeful activity. In other words, preparatory methods should not be used throughout or for the duration of the entire OT session. One example of a preparatory activity is stimulating a muscle through vibration in an attempt to activate muscle fibers for contraction and subsequent movement. One specific example of this is applying vibration to the hand of someone who has had surgery for carpal tunnel syndrome. But again, keep in mind that this is a preparatory activity, as it states, in preparation for completing a functional task. Here's a couple of important points about therapeutic exercise. Therapeutic exercise is a modality from the biomechanical frame of reference. If you recall, if we're thinking about the biomechanical frame of reference, we're thinking about the actual physical disability. The goals of therapeutic exercise are to increase muscle strength, maintain or increase joint range of motion and flexibility, improve muscle endurance, improve physical conditioning and cardiovascular fitness, and improve coordination. Let's take a look at some examples of therapeutic exercise. This slide consists of examples of clients using or completing therapeutic exercises during treatment sessions. Please see the notes attached to the slide for further explanation. This slide consists of 3 pictures of the BTE machine that is used for therapeutic exercise. There will be more detail on this particular type of equipment in the second part of the presentation. Physical agent modalities, or PAMs, are also considered preparatory methods. They are used to bring about a response in soft tissue and are most commonly used by OTs for treating hand and arm injuries or disorders. Let's take a look at the different types of physical agent modalities, or PAMs. There are thermal modalities that involve heat transfer to an injured area. They are used to decrease pain and joint stiffness, also to increase motion, increase blood flow, reduce muscle spasms, and reduce edema. Examples of thermal modalities that involve heat transfer include warm paraffin baths, hot packs, whirlpools, and ultrasounds. Then there are thermal modalities that involve cold transfer to an injured area. They are used in the treatment of pain, inflammation, and edema. And examples of this include cold packs and ice. The third type of physical agent modality are electrical modalities, which are used to reduce edema, decrease pain, increase motion, and re-educate muscles. They include media such as the following: the TENS unit, the FES, and the NMES. This slide includes examples of PAMs using heat transfer. To your far left, you have the paraffin bath. To the right, your hot pack. Below the hot pack, you have a whirlpool. And to the right, the heating unit for the hot packs. Other PAMs using heat transfer include the fluidotherapy machine and the therapeutic ultrasound. You can find a link to view the fluidotherapy machine at the end of this presentation. This slide consists of pictures of PAMs using cold transfer. The top two photos are of cold packs, different designs of cold packs. And below, there's a photo of the storage unit for the cold packs. This slide consists of 3 examples of electrical modalities. On your top left, you have a TENS unit. To the right of that, you have the FES unit, or more specifically, the Bioness H200, which you can take a look at a demonstration of by going to your additional resources at the end of this presentation. And at the bottom center, you have the NMES unit being used during treatment. 3 final points on physical agent modalities. 1, the use of PAMs in OT is controversial. 2, the AOTA developed a position statement, which you can read here. 3, PAMs are not to be used by entry-level practitioners. Here is a list of additional resources on intervention modalities. Please be sure to watch Part 2 of the presentation on intervention modalities. Part 2 will continue with preparatory methods, more specifically orthotics, and then conclude with purposeful activity.